My guest this week is Dr. Sandeep Bolia, an established private GP and personal physician based in London. A qualified doctor for over 20 years, with experience in both general medicine and emergency medicine, Dr. Bolia has dedicated the past 12 years to looking after the health of a number of individuals and families. When he's not got his GP hat on, Dr. Bolia is flexing his entrepreneurial side, overseeing various ventures within the healthcare sector, including running a medical cannabis business, a global health concierge, and formulating a sleep remedy. When it comes to treating his patients, Dr. Bolia believes that a holistic approach and time spent understanding the individual allows for the most successful treatment and recovery. He says that rather than focusing only on curing illnesses, we should look at the overall picture of how to achieve a consistent state of wellness for both our body and our mind. Sandeep, welcome to the Fibromyalgia podcast. Thank you so much for joining me today. I'm sure your working life has taken a bit of a U-turn in the past year. How has kind of introduce yourself and your practice and what you're doing?
Sure. Nice to connect with you this morning. My name is Dr. Sandeep Bolia. I'm a private GP and personal physician in London, and I've been doing that for about 12 years, and look after a few individuals and a few families, and as well as having an entrepreneurial sort of instinct and working on a few ventures in sort of the healthcare sector as well, but not in a clinical role. So that's been, the last year has been extremely busy, clinically and non-clinically. So, very troubling times, I think, for everybody. So, I think it's, I think a lot of people's healthcare needs are unfortunately getting pushed to the sidelines because of, the dealing with the acute emergency of the coronavirus. So I think it's good to have podcasts like these to address the health concerns of, maybe chronic conditions that aren't to the forefront of people's, vision at the moment.
Well, firstly, thank you so much for taking time out of your busy schedule anyway, even busier schedule this year. Much appreciated. As you mentioned, people's conditions are potentially getting pushed a little to the sidelines because of everything that's happened during the pandemic. So you've been a GP for how long?
For about 12 years.
For about 12 years.
As fresh-faced as I look. I've been, there's a few touches of grey in the hair now.
I can't see them.
I've been a GP since 2008 is when I got my full sort of qualification as a GP, but I have been a doctor for 22 years.
Okay, so wealth of experience under your belt.
Yeah, hopefully not 20 iterations of the same year, but
Okay, so this is going to be a hard question to answer, but in that time, how often have you ever actually diagnosed somebody with fibromyalgia?
So to that question, no. I have not diagnosed someone with fibromyalgia myself. Sort of fibromyalgia is one of the things that I know the term, but probably my knowledge was pretty poor around it. And so using the website, which is a fantastic resource, it was a really good refresher around, I suppose, the symptomatology and presentation of patients with fibromyalgia. And it made me realise that I did have pretty large knowledge gaps. I can think of the first time I came across fibromyalgia was as a condition was in my final year of medical school.
Right.
I think it was the last sort of terms or something before we were we finished our 5 years, and it was sort of, I think it was within sort of rheumatology is the first time it came across, and it was based around if you were tender over the various points of the body, and there were these trigger points, and you would assess people for that, and that was essentially the diagnosis. And I think going through hospital medicine, there was never a mention of fibromyalgia, and I did a lot of work in A&E, and there was no there was no visibility of fibromyalgia. And then even in general practice, I did some work in the NHS, but I've essentially been a private GP, as I said, as I mentioned earlier, for the past sort of 12 years. It's never really been in my eye line. And however, that's probably been a mistake. Knowing what I do now, I think I'm a little bit more vigilant around what it can be. But I think the problem arises because of, I think healthcare, medicine, diagnosis often about certain symptoms that are indicative of a particular condition, and you kind of go, oh yes, someone's got a fever, they've got an infection, or so it's these kind of things. And I think because the presentation around fibromyalgia is never really distinct, although there are and there's a wide sort of spectrum of presentation, and there's a lot of crossover with a lot of other conditions. I think it can easily be missed, even though the prevalence of the disease is probably pretty common.
Yeah, well, the stats are kind of saying that it could be anywhere between kind of 3 and 8% of the population has it, which is massive. It's millions of people.
It is massive. I suppose then it's about understanding. It's a collection of sort of symptomatology rather than a specific sort of condition that we can diagnose with a blood test or something. It's not like blood pressure where there's a arbitrary cutoff around the figure. So, and I think it just shows that it's important to push the message out there. So, GPs in particular, because I think it's primary care who are probably seeing the most people with this condition, need to be aware that this could be what is going on.
So then it's famously tricky to diagnose. You're saying that there's lots of gaps, from medical school, that's where the gaps kind of start. Where does somebody go then if somebody comes into your surgery and is presenting these symptoms, which, as you say, do cross over with lots of other conditions? What is kind of the journey that somebody could expect to go on starting at their GP?
I suppose it's, number one, it's about, it can be the luck of the draw sometimes. Does your GP know about the condition? Are they aware of it? Have they got the time to explore some of these symptoms? I think it's about understanding the key questions around it, which are, asking people about the pain, the nature of the pain. Characteristically, it's described as a burning pain. And it can be head to toe, not just these sort of trigger points. The pain can fluctuate. There can be episodes of pain. People can be pain-free. I think it's also about these kind of key things around energy, where people just feel that suddenly they're drained of energy. I think sometimes it's about the precipitant. I think there's a link with traumatic episode.
Okay.
Bringing these symptoms to the fore, but again, it can be quite an insidious onset. I don't, it's not always clear cut. There can be a lot of sleep disturbance as well, tight muscles, as I mentioned before, fatigue. So a lot of these symptoms are quite general. Yeah. And as I said, can cross over with a lot of other conditions. Insomnia, sleep disruption has multiple causes. So does fatigue as well. So this is one of the problems. You can kind of get lumped into a whole group of patients.
So there's nothing specific that stands you out as a fibromyalgia patient?
Sometimes, yeah, unless there are, I think, unless a doctor knows about it and has been looking for it, and they ask the specific questions around it, I think it can be a tricky one to diagnose. I think people can float around in this kind of, in the ether around people with sort of chronic symptoms and, tired all the time. And it depends then on the skill of the GP. The first thing I personally do if I see patients with a collection of these kind of symptoms is I will make sure that there's, there'll be an examination, an assessment of the history, what else is going on. I'm an advocate of blood testing, so I do a lot of blood testing myself and a lot of my clients. and and I think as a private GP in the space, and my own sort of progress as a clinician is to I'm trying to get my patients to a position of health as opposed to just identifying disease. So a lot of my blood testing is quite sort of general and there's a wellness orientation around it, but I'm always looking for things like are people anemic or not, what's their iron status, B12 folate levels. I will look at abnormalities around thyroid function. So these are the kind of things that I am trying to look at, because I'm trying to exclude any reversible conditions. So
it's a process of elimination.
Yeah, absolutely. I mean, medicine is sometimes like a big game of guess who. You don't always get to the answer by a positive question, like going, like I said, blood pressure. It's an arbitrary cutoff.
Yeah.
It's a figure. So if your blood pressure is above that for a certain number of occasions, that you're more than likely to have high blood pressure. But with certain conditions, it's a process of elimination. And that's what this can be. So it can take a little bit of time. I think sometimes some of the limitations of that patients can experience in the NHS is that continuity of care. Do you see the same GP? Have they had time to, ask questions? I mean, 10 minutes for an appointment, which seems like a standard time, is extremely difficult, because during that 10 minutes, the patient feels that that's the patient's 10 minutes. However, the doctor feels, well, that's also my 10 minutes, because the doctor's asking you, have you had your flu jab? How have I checked your blood pressure? Have I asked you about your alcohol consumption? Because the doctor has certain
checklists to get
things
through.
that they have to, absolutely. And that, unfortunately, that's the system that they operate in. So it can be very, very challenging for patient and doctor to feel that they've managed to get everything done. And then you might, so the diagnosis may be missed at that point, and that might happen a couple of times. And, the patient then can enter this kind of sort of system when no one's really listened, no one's really picked up on what they've got. They may then be sent for some blood tests. I mean, have they been sent for the right blood tests? What happens to the person? Are they just diagnosed with anxiety?
Yeah, because the average time of diagnosis is around 7 years, which is so frustrating if you're in this constant battle of pain and fatigue and reaching no answers. And so,
I think.
Sorry, Karen. So, can it ever be conclusive? Is there ever actually this is officially what you've got, or if it's just kind of we've reached the end of lots and lots of roads? This is probably what you have. Here's a label.
Yeah, I think so. I mean, this is where specialists come into the equation as well. Although it's not always the easiest to see a specialist within the NHS. There is some pressure for GPs to try to manage things in primary care. Without referring on to specialists. And the waiting time to see specialists can be quite extensive. And that's, unfortunately, I suppose, with COVID and the disruption that's happened to the country as a whole, to the NHS, these waiting times are just going to get longer and longer. So I can kind of completely see how patients can get sort of stuck in this
hamster wheel
fog, and it might just be there's one part, or some doctor sees it, or there's some kind of light bulb moment, or patients themselves. I think one of the things that the internet has brought is access to health information. Before you had to speak to your doctor because your doctor was all-seeing, all knowledgeable, apparently.
You still are.
But now Professor Google is open at all hours. So,
but presumably that's quite dangerous if a patient comes to you and goes, I'm pretty sure I've got fibromyalgia. Like, no, you don't.
Yeah, it's. I think a lot of doctors kind of go, oh God. But to be honest, I find it refreshing, because I think often patients do know the answers. That's an age-old adage. I was kind of, one of my senior doctors when I was at medical school always said, listen to the patient. And and I think that sometimes you have to, Professor Google is fantastic. He's open, he's free, he's always listening. But I think as a doctor, I'm able to have a dialogue with Professor Google. And patients not necessarily armed with the knowledge to be able to have that dialogue and understand and how to filter that knowledge. So I think for the foreseeable future, I don't think there's an algorithm to replace my 22 years of experience. Thankfully, so I don't think I'm on the scrap heap just yet. But as long as doctors can kind of get through, sometimes there's a lot of pride around this or whatever. But I think it's always good to address these kind of concerns. And patients are often know the answer. They've often looked at things, and it's worthwhile listening to the patient and seeing what's going on. And it might be that the doctor goes, yes, look, this could be a possible diagnosis. I know that a lot of patients do with fibromyalgia because of the issues around pain. They do end up going into pain clinics. In secondary care, which are essentially run by anaesthetists who specialise in pain management. And if they're fortunate enough to get to see a specialist who can sort of help assess the condition and control it, that's very, very important. And there are certain medications that can be used to help with fibromyalgia, but from my understanding of fibromyalgia, there is not just one, as we've talked about, there's not just one clear symptom. There's also not just one clear magic bullet treatment. Treatment is sort of multi-level. It's, I think you've got to address all of the factors that are going on for this patient, be it emotional, sleep. It's about, I think exercise can be very beneficial, but it has to have some kind of structure to it that the patient can do according to how well they're feeling.
Okay, let's talk about some treatments then.
Sure.
So there's no actual cure, but there are definitely ways that people can manage their symptoms and their pains. So in terms of actual medication, is there anything that you would be prescribing whilst people are on their kind of journey, if they're not able to see a pain specialist? Anything kind of over the counter?
I mean, there are certain medications that can be started in primary care. I mean, there are, duloxetine is a antidepressant that's often used for people with pain, and I think it's sort of twofold. It can not sort of help with dealing with anxiety, any underlying sort of anxiety, depressive symptoms, but also can affect the sort of the manifestation of pain in the body. So that's something that is used. There are also medications like that sort of help to stabilize the nerve endings, because obviously pain is perceived through the nervous system, and things like pregabalin, which are used. So there are a few options out there.
And are those things okay to be on for a long period of time?
Yes, I think they are. These are medications. I think once people are on them, I think they're quite difficult to take people off. But that's if they're helping. If they aren't helping, then hopefully when a patient has had a medication review with their GP or something, that is reviewed and there's some management going on as to try to help these patients. But I think there's management is usually pharmacological, as in using medication, and non-pharmacological. Because some of the other things that we talked about, dealing with mental health, maybe through CBT.
So let's go into some more kind of lifestyle strategies then, because for lots of people they don't want to be having to rely on taking medication every single day. So is there a kind of a game plan of kind of trifecta of diet, exercise, and mental health strategies to help you relax, lessen your anxiety, etc., that you would kind of put in place for a patient?
Yeah, I definitely. I think this is part of my own practice anyway, where I'm trying to move my patients to a position of health. So I'm looking at sleep and how to try and optimize sleep. So sleep hygiene is important.
What's sleep hygiene?
So sleep hygiene is the steps you can take to optimize your mind and body to get in readiness for sleep. So I think it's about avoiding caffeinated drinks, and people's bodies sort of metabolize caffeine at different rates. So some people are very sensitive to caffeine. It can take them a number of hours to reduce their, the effects of the caffeine in the system. So, it's almost best to avoid caffeinated drinks after noon almost for a lot of people. Because some people do like their teas and coffees, and but if you're particularly sensitive to caffeine and you're having cups of tea or coffee at sort of 6 p.m, then that's going to have an effect on your sleep. I think it's about getting some sort of reduce your screen time down, because there's this sort of narrative around whether it's blue light from the screens or just brightness of the screen, but that can be very disruptive for people. The blue light, that there is been some evidence in the past to suggest that it disrupts the production of melatonin, and melatonin is the sleep hormone that readies the body for sleep. So, but there's also a school of thought that says that this is just the brightness of the screen that's causing this. So some people have, wear blue light blocking glasses. Some people, it's just a matter of turning down the screen brightness. I think there's probably a case for both. But I think limiting screen time, maybe trying to switch your screen off a couple of hours before you're due to sleep. I think it's also about removing the stimuli around you, and trying to change reading lots of disturbing news stories or things like that, so things that are going
hard to avoid at the moment.
It is. It can be very difficult, but I think this is about discipline around. If you're having problems around sleep, I think it's about trying to do whatever's possible to try to combat these issues, because sleep is incredibly important for the body to regenerate and for your performance the next day. And chronic insomnia has got a lot of health risks over time. So I think things like having a bath, turning the lights down, TV off, reading a book, listening to some relaxing music.
Sounds lovely.
Can be very, I think it's about, almost, I think there's a lot of breathing exercises that people do to try to just slow their bodies down. There's this, I suppose, a way of promoting the autonomic nervous system is this kind of autopilot in the body, and it controls a lot of our bodily systems. We have a bit of control on it, not. And there's a sympathetic nervous system which is useful for getting everything going. It's that fight or flight response, and it's very useful for us. But we need that at certain times of the day. But then also there's the parasympathetic system, which is slowing the body down, getting ready to heal, getting ready to sleep, relax, and that is what should be getting stimulated before you sleep, so the body is ready to relax.
And in terms of fibromyalgia, then often the symptoms is related to non-restorative sleep. So what does that mean itself? Do these things promote non-restorative sleep?
People just feel that they've not had any rest. They've sort of slept, but it doesn't feel like they've slept at all. It's very. I think again, remembering. I think it's about very poorly refreshing sleep. You just don't feel as if your body is rested.
Okay, so sleep hygiene and putting these kind of relaxation methods in before you go to bed can help to promote.
Absolutely, yeah. I think sleep optimization in the wellness market is a very, very big.
It's becoming huge.
There's lots of sleep supplements being produced, and there's a lot of marketing around there, and some of these products, from my review of them, some of the products seem quite interesting. So, anecdotally, I haven't really looked at the evidence in detail, but anecdotally, a lot of people find benefit from them. Whether this is just sort of placebo or not, I'm not sure, but a lot of people find benefit from some of these some of these sort of natural formulations, because sleep, sedatives that are prescribed from the GP aren't necessarily very good at promoting restorative sleep. They can put you to sleep, but it's whether it's actually putting you into a deep, refreshing sleep, which is the key.
So what sort of things are they, like lavender, CBT?
So the looking at these non prescribed options. I know that there are things like valerian root. Is something that a lot of people find benefit with. Lavender is an interesting one because it can help calm and reduce blood pressure, but it's something that I'm conscious about in men because there is some evidence to suggest that it can reduce testosterone levels. So it's something to be a little bit careful about, because a lot of essential oils and things, they can be very powerful. Again, just things that I am learning about as I'm trying to expand my knowledge. And this is where something I was probably saying earlier. I think it is an education of doctors at medical school that has a big, is a problem in a lot of ways, because we had very little training around nutrition, very little training around the concept of a well human being, and what you do to be well. We were only ever trained around treating illness and disease.
Whereas actually it's like the whole package, isn't it? This kind of more holistic approach. It's definitely becoming more kind of mainstream, if you will. But I think people really are starting to understand, like, if you have everything in check, then your overall health should be better. Obviously, you can't avoid illnesses and things, but,
No, absolutely. I think maybe around coronavirus and stuff, some of the failings of modern medicine have been apparent. We've not been able to prescribe our way out of trouble. There's some hope for these there's some newer therapeutic inventions coming in, these antibody cocktails. There's a lot of hopes pinned on vaccination, which are with new technology vaccines, the RNA vaccine. So there's a lot of hope on these, but we the basics of what is a healthy human being, a lot of doctors have no understanding of, and which is I think is a big problem.
We're technically being prescribed daily exercise now, aren't we? And
I think these are very powerful. One of the largest modifiable risk factors for disease is exercise or lack of. It's very, very simple. I think this is where this 10,000 steps.
Which is a lot. It's a long time to fit that in.
It is. But it gives us sort of a target for people to be moving towards. And I think, what's interesting is I have a friend of mine who works in the gamification of sector, and they looked at gamification of exercise because casting your mind back, I suppose, to the Pokemon Go. They were able to, because all these millions of people downloading the app and going out to hunt for Pokemon in the urban jungle, and but they were able to track how these people, how many steps they took. They were also able to then extrapolate how many calories they burned.
And I bet they were taking more steps than ever.
Yeah, absolutely. And they were, and this is a group of people who normally were at home playing games, and they were actually out, and they realised that this is a concept of gamification of exercise. People are out doing things, being active, and the reward was a Pokemon. So
that's so interesting. It's like the watches people wear and stuff. You want a reward for your output.
Yeah, there is even I think there was a virtual currency put forward that called a sweat coin.
Sounds horrible.
By doing a certain amount of exercise or visiting the gym or doing sort of healthy things, you could earn a sort of sweat coin which had a value.
Wow.
So I think there's some interesting concepts around around exercise, but I'm always going off on tangents.
Well, for a fibromyalgia patient or somebody with chronic pain, obviously you can feel exhausted a lot, and exercise is the last thing that you're going to want to do. So how do you then kind of implement that into your everyday life? Is it a case of, just a bit of stretching is as good, or a gentle walk?
Yeah, I think stretching is something that can be done anywhere, and I think, to be honest, we should all be doing stretching, because it's a natural thing to do. I mean, when you look at the animal kingdom or wherever, we always see domestic animals stretching, stretching themselves out, and this is a natural thing for us to be doing. I mean, a lot of people stretch, but they don't stretch for long enough. From my understanding, you need to stretch for at least a minute, because it takes 30 seconds for the muscle fibers to essentially to kind of unlock.
Okay.
So if you're stretching for 20 seconds, you're not really stretching. You stretch for 30 seconds, muscle fibers sort of unlock, and it's that next 30 seconds where there's the actual stretch. So
even if it's just a minute or two a day, if you're, in a lot of pain, just making yourself do that few minutes.
I think fibromyalgia patients can be prone to more sprains and muscle injuries because the muscles are often very, very tight, and stretching muscles out can be done anyway. You don't really need specific equipment, and it's a good way of trying to it's a good way of trying to release that sort of pain around muscle spasm. So on the lowest end of the spectrum, I think that can be very, very powerful, is stretching. And depending, as we said, on how that individual is feeling that day, you can increase exercise to different levels. But I think it's trying not to be too exhausted as a result of the exercise, but doing enough that there can be that beneficial effect on getting the body moving, and getting the endorphins going, and getting the benefits of that exercise on your physical health and your mental health.
And in terms of diet, then, are there any kind of, I know you've spoken about you not having a lot of expertise in nutrition, but is there anything specifically for somebody with a chronic pain condition diet-wise that you would definitely be avoiding or definitely be including more of?
Again, you're kind of exposing some of the limitations of my knowledge here. I'm not 100% sure about that. I'm again looking to, in my own practice, as I mentioned earlier, getting people to a position of health. So I'm trying to get a balanced diet. I'm aware of, there's a few doctors that I read about who are interested in nutrition, and I think I'm an advocate of eating blueberries and some vitamin C. I think fruits and vegetables are very important, because they have a huge mix of minerals and vitamins and minerals that are very beneficial. So I think it's it's having a balanced diet with a lot of I think brightly coloured vegetables within that. That's very, very important. It's about I suppose not having too much processed food, because processed food can, is renowned for possibly causing a lot of issues within the digestive system. I think more and more we are understanding that the gut and the microbiome which is the balance of, it's the network of microorganisms within our bodies, in our gut, it is the interface for most disease processes. We have the gut-brain axis, where what we eat influences our mental health, but we also have the brain-gut axis. It's a two-way place, because we also know that when we're stressed, we can get we can get diarrhea and these kind of gut issues. And fibromyalgia, there's a link with IBS as well.
Okay, so a lot of it is about looking after, if you're having a happy brain, then you can kind of have a happier gut. Is that what you're saying?
Yeah, and I think it's a two-way process, So there is a connection, because the gut has a huge amount of our immune system is based around the gut, and there's a lot of nerves and networks of these nerves around the gut as well, and so there is a lot of sort of feedback between the two, and it's like a two-way process. So what's happening in the gut affects the brain, and what happens in the brain affects your gut as well.
Okay, so you need to look after brain and gut. And
So
you've spoken about having a holistic approach to your patient. So we've spoken about exercise and diet and sleep. Are there any kind of other alternative remedies or therapies that you would maybe point people in the direction of?
Absolutely. I mean, I think alluding to, as I alluded earlier, was around pain clinics, pain consultants.
Yeah.
I think we're about 2 years into medical cannabis being legalized so cannabis being legalized for medical use in the UK. It's been on for about 2 years.
Are you an advocate of that?
I am. I went to a conference on I think it was November 2019, when
When we were free.
It was the first year anniversary of medical cannabis being prescribed in the UK.
Yeah.
And there was a lady called Hannah Deacon, whose son Alfie, who had a particular syndrome, and he was having a lot of seizures.
Right.
And she was desperate for help and tried all sorts of pharmacological treatments, and nothing was working. And she ended up going to Holland because she had read about medical cannabis, and it had a profound effect on the control of seizures in her son. And she fought a real battle to try and get it allow her son to be prescribed it in the UK. And it's an extremely emotional story. She's an amazing woman. And then there's a few doctors who sort of sprang up to support her. Professor Mike Barnes is a real powerful figure in the scene, and Professor David Nutt, who is an extremely outspoken, fantastic guy. So there's a growing number of doctors who believe in the power of medical cannabis, and unfortunately, cannabis is tainted with the sort of shadow of its recreational pedigree, and people, the stuff that's being available in the streets, which is often extremely strong and not grown in a controlled way, is a very different use here. This is about medical cannabis. There's the use of this plant, which is an extremely complicated plant as a medicine, and it has been used as a medicine for probably 4,000 or 5,000 years, across the world in a lot of cultures. But I think looking at the history of cannabis, I think since the end of Prohibition in America in the early part of the 1900s, there was a systematic global push to malign the use of cannabis, and hence a lot of that it's becoming illegal in a lot of countries. I think thankfully people are going back to look at medical cannabis, and the use of the plant, whether it's CBD on its own, which is the non
hallucinogenic
part of the chemical plant that doesn't cause a sort of a high, and that can be very good as an anti, for inflammation in the body. It can be very useful for pain, mental health, anxiety, multiple uses. But it's the kind of the combination of that with some of the THC, tetrahydrocannabinol, which is the part of the plant that gives the kind of the high, as it were. But when it's combined with the CBD, and depending on the concentration, it's extremely good for pain relief. It's extremely good for sleep as well. And it's kind of the balance between the two ingredients. Although the plant has lots of other ingredients within it as well, for example, terpenes and flavonoids. But I'll try not to complicate things.
So people
from
are,
my knowledge,
if people are self-medicating, look for the mixture of the two, THC and CBD.
Yeah, I think a lot of people cannabis is being used widespread, whether doctors like it or not. I mean, there's a huge amount of recreational use, but a lot of people are using it from the street recreationally because it helps their pain, and it's being used for a variety of conditions. And I think that is that again, it's about listening to your patients. I mean, I've come across patients, my colleagues who work in medical cannabis, they've come across patients. That's been often that was the stimulus for them to listen, was that the patient saying, look, the stuff that you prescribed me was rubbish. I've been using medical cannabis and that's really helped me.
Yeah. So
And
do you
if
prescribe
you
it then yourself?
Pardon?
Do you prescribe medical cannabis then?
I can't because it has to be. I'm not working as a clinician in the space. I've helped set up a clinic and working in developing a medical cannabis business, but I'm not working as a clinician within it. But what normally happens is that it has to be started by a specialist, so by a consultant, be it a brain specialist or a neurologist, there are, or a psychiatrist. There's various specialists who are prescribing it, and then GPs. Once the patient is stabilised under a shared care agreement, GPs then take on the repeat prescribing. But this is usually done through private clinics. The NHS unfortunately hasn't really got up to speed with this, and it's the private sector that seems to be making the progress around medical cannabis. But hopefully, the more people that, more clinicians, the more patients that are aware of the benefits of it, as well as the risks. But it can be extremely effective, especially when combined with the other things that we've been talking about. And I think FM UK is a very powerful platform for people to gain information around the use of medical cannabis.
Yeah, it's so interesting. Thank you so much for talking to me. You've really kind of highlighted as a condition, the kind of holistic approach that patients need to take, and that they shouldn't be feel awkward about going to their doctor armed with their own research and information. You'd be happy for somebody to come and say, actually, I think I could have this. Can you send me down this route?
I think so. I think, in a way, doctors just have to realise that patients are there and that patients are doing a lot of work. And if you listen to your patients, if you have time to listen to them, they will often tell you what is wrong.
Well, patients know best, if it seems.
Always.
No.
Thank you, Verity. It was really it was great to be able to speak to you, and also it was useful for me because it going back and learning about the fibromyalgia has made it more. I'm more aware of it, and I'm more on the lookout for it, for something that's obviously very common in the population.
Brilliant. Thank you so much.